Are you having low back pain with achiness usually in one side? Have you heard about the Gluteus Medius? Welcome back to my channel, Annie Pilates Physical Therapist. This video, I will be discussing the anatomy, the function of this muscle, and some demonstrations so you can follow along and strengthen this lovely muscle that will help support your spine. So get your mat ready and join me. So let's discuss first the anatomy of the Gluteus Medius. It's a muscle that's part of your glutes muscles. So it's underneath and on the side of the gluteus maximus, which is the largest muscle of our body. So if there's the medius, the maximus, and the minimus. So the medius starts on the origin of the iliac crest, the ilium fibers. So it's like a fan shape all the way down to the sciatic notch. So this muscle has the anterior fiber, middle and posterior fiber. It's almost like the deltoid of the hip. If there's a deltoid of our shoulder that helps stabilize this shoulder, this muscle is so important to stabilize the pelvis. So if there's weakness in one side, it causes a drooping on the pelvis that causes that shift, causes some sacroiliac dysfunction on your pelvis area, as well as the foundation of your spine on your sacrum and lumbar area. Because of the origin of the muscle, if there's weakness, then it gets really painful and achy and stiff. The anterior fibers help during flexion for medial rotation or internal rotation. So you'll be surprised it's not just a major abduction of the hip. So it helps initiate the abduction as well as stabilize the pelvis. And then the posterior fibers of the muscle help extension and external rotate. And then the middle fibers helps abduction. Just imagine there's so much function on this muscle. So if you don't strengthen this muscle, it will limit your flexion and medial rotation, abduction, and extension and external rotation. And because there's so much fibers, so there's anterior, middle, and posterior fibers. It's almost like your deltoid of your shoulder. There's anterior, middle, and posterior. Each deltoid fiber has a different function. So that's the Gluteus Medius. It helps stabilize your pelvis, and it helps keep centered like a heart-shaped pelvic bone. And if there's weakness, it causes a lopsided pelvis. And there's more impact rotation on your spine, so you're going to have low back pain and sometimes bursitis on your hip. So this is a very important muscle to strengthen, and usually gets really weak fast, not like your minimus and your maximus muscles. The maximus is the largest muscle that helps for squatting and hip extension. So the first exercise is side lying. So you're going to lie on your right side. So I'm going to focus on my left, which is my weaker side. And this is the heel slide. So you're going to slide your heel on your shin area on the lying side. Take a deep breath, belly button in, and slowly extend your leg to extension, and then slowly go down and blow. You engage your core by taking a deep breath, pulling your belly button in. So slide, inhale, one breath is one motion, and blow, and then slowly go down. My recommendation is to do this up to 10 repetitions. But if you're a beginner and this is too difficult, especially with tightness, it's okay if it's not that straight yet. If your first time because of weakness, it's okay just to slide it. Let's try your best to straighten it up and down blow. The slower the better, and more muscle contraction. You're gonna feel your gluteus medius working hard, and you might feel some spasm and pain. And that's fine as long as you're doing it gently and you're doing a contract relax. So take a deep breath, lift gently, and down blow. So if you notice, I'm not plopping my foot down, I'm doing it gently. Inhale through your nose, belly button in, and lift and down. So you feel that lovely stretch. Take a deep breath, belly button in. So when you're doing this position, you feel it contracting, and extend. You lengthen the muscle and down below. And slowly build it up to 10 reps. And it's okay. Making sure you're engaging your core, stable with your hip, or else you're gonna lose your balance and blow. Now we'll do reverse. This time you go up first. Inhale, you can feel your gluteus medius bend and slowly go down and blow. Keeping your back in neutral with your breaths. Inhale, belly button in and blow. Feel that lovely stretch and contract, relax of the muscle. Inhale through your nose. We'll do 10 reps again, focusing on my left side, and this is for demonstration only, and my recommendation is 10 repetitions. And it's okay to start with a few reps if you feel like it's so weak on your gluteus medius. Inhale through your nose and blow. Belly button in. Engage your core muscles. Inhale and blow. Take a deep breath through your nose. Belly button in and blow. Inhale. Slowly and surely. Last one. You take a deep breath and then hold it on this position. And if you're leaning forward like this, you're targeting your hip flexor. So you want to make sure your back is straight, neutral, looking forward, not upward. And we're going to slowly do small circle clockwise first, like a size of a small dish. 10 repetitions, and you're going to really feel the burn on that muscle. Inhale, belly button in, engage your core, and blow. Breaths. Inhale through your nose, feel the burn, and you know it's really weak. And my recommendation is also to target the other side so you can see the difference of the strength of the muscle. Now reverse, counterclockwise, small circle. The slower the better. Making sure you're not rocking your hips. Control, targeting that muscle. And you can put your head down. If your neck is hurting, you don't have to lift your head up. Inhale. You can use a pillow to support your neck. Belly button in and blow. Take a deep breath through your nose. Feel the burn. Last 2, 4, and 1. Woo, feel the burn. And the next one is clamshell. So this muscle is also being targeted with this exercise, and you open, lift your knee up, so with your knees bent, so it's like a shell opening. And my recommendation is 10 reps and hold it for 5, 4, 3, 2, 1 and down. And the progression of this exercise, you can put a band around your thigh area, not on your knee, so you won't hurt your knee. And do it as well with the band. And there's different resistance band you can start with, and my recommendation is start with the yellow band. That's usually the lightest before you go to the darker color bands, the therapeutic TheraBands that you can purchase online, or some of them are different variety of strength. Depends on the resistance you can tolerate. And this is the progression with your feet up. So this has more range and really targeting that area. This is the origin of the muscle. Remember I said it starts on the iliac area, and you can feel it here. So it feels like a low back pain, and even though it's not your spine, it's your hip. It's amazing how it causes pain if it's weak. So hold it for 5, 4, 3, 2, 1, and my progression again is to progress with the band around your thighs, wraps around, and I'll show it to you next video, the progression, and I'll do a follow along program. Take a deep breath, belly button in and blow. So the next one, because the gluteus medius is an internal rotator with your leg up like this, so it's reverse clam and blow. So this helps target the gluteus medius when your hip is in slight hip flexion. So when your knees bent, lifting your heel and down. Take a deep breath and hold it for 5, 4, 3, 2, 1. And the progression again is placing a TheraBand around your ankle and resisting it in this way. And you feel more on the origin of the muscle near your low back area. Take a deep breath. Don't forget your breath. Belly button in, engage your core, and blow. 3 more to go. Abel is sleeping well, snoring loudly. 2 more. Take a deep breath. Belly button in and blow. Last one. Take a deep breath. Inhale through your nose and blow. So this is the last exercise. We call it the Gluteus Medius, targeting it with your knee bent all the way down to the mat, keeping your back in neutral and gently kick back. It's almost like a PNF pattern with your heels up, internal rotate, toes pointing down the mat, and you really target that muscle and blow. Take a deep breath through your nose. Belly button in, feel the burn. So this is the hard one now as you progress. And if you can do only a few repetitions, that's fine. And I could feel it now on my left side, which is my weaker side. So in my next video, I will be showing in both hips. I recommend doing it both so that you are balanced and your pelvic will not be unstable. So next video will be a follow-along program targeting the gluteus medius, and I will add the TheraBand. So you should bring a TheraBand as well on our progression as you continue doing this daily for a week. And I think you're ready for the progression. 2 more to go. Take a deep breath through your nose. Belly button in and lift gently. Toes pointing down, heels up to the sky. Last one, feel the burn, and we're gonna hold it for 5, 4, 3, 2, 1, and down. And that's it. I'm hoping you learned a lot on this gentle Gluteus Medius Pilates-based physical therapy treatment plan. Please like the video and subscribe to my channel. Ring the notification bell so you're updated for future updates just like this one. I upload videos every Wednesdays, Fridays, and Sundays, sometimes Mondays, for Pilates, physical therapy, wellness, yoga, and health. And you can also follow me on my social media, my Facebook, Instagram, and Reddit. And I have more social media you can check down the link below. Thanks again for watching. I'm hoping you're feeling much better in your low back area with our simple, gentle, Pilates-based physical therapy. Have a great and healthier you. Bye!